Welcome to www.diabetesplan.org. My name is Pat Bass, and we hope to let you know what you need to know and what you need to do about your diabetes at our website. Today we're going to talk about what is prediabetes. Basically, prediabetes is when your blood glucose levels are greater than normal, but not yet high enough to be diagnosed with diabetes. About 10% of patients diagnosed with prediabetes will convert to diabetes every year. So in 10 years following a diagnosis of prediabetes, many people will have gone on to develop full-blown diabetes. While not everyone with a diagnosis of prediabetes is going to develop diabetes, you must follow the recommendations, most of which are outlined here, if you're going to have a significant chance of preventing the development of diabetes in the future. So who's at risk? There are many risk factors for prediabetes that you need to be aware of. If you fall into any of the groups that we're going to talk about, then you should talk with your doctor or healthcare professional about testing for prediabetes at your next visit. The first at-risk group are people who are overweight, especially if you carry weight in your midsection. The second group is people who are physically inactive. If you don't get the equivalent of walking 30 minutes for 5 days a week, then you are considered physically inactive and therefore at risk potentially for prediabetes. The next group of people at risk for prediabetes is smokers. While the science explaining this isn't totally clear, there's increasing evidence that smoking increases both your risk of prediabetes and of diabetes. The next group of at-risk patients are those with hypertension and high cholesterol. Because prediabetes and diabetes increase your risk of heart problems and stroke as much as 50% in these patients, it makes sense that you'd want to screen people for other diseases like diabetes that also increase the incidence of cardiovascular disease and stroke. If you had elevated blood sugar during your pregnancy, this increases your risk for diabetes in the future. As a result of this, if you are diabetic in pregnancy, you need to be tested for prediabetes. And finally, the last two risk factors you really can't do anything about. The first is your family history. If your mother, father, brother, or sister has a history of diabetes, then you're at risk for developing diabetes as well. And then there are certain ethnic groups, Asians, Latinos, and African Americans, that appear to have diabetes and prediabetes at higher rates compared to Caucasians. And so if you have any of these risk factors, which are unmodifiable, especially if you're overweight, inactive, a smoker, have high blood pressure, cholesterol, or had diabetes during pregnancy, or you have a family history of diabetes, then you want to make sure that you get screened. How do you know if you have prediabetes? Well, when you get tested, there are several different tests that your doctor or healthcare provider may do. The first is a fasting blood glucose. So basically, you have your blood sugar measured first thing in the morning after an overnight fast. If your blood glucose is less than 100 milligrams per deciliter, this is considered normal, and you don't have prediabetes. If your blood sugar fasting comes back between 100 and 125 milligrams per deciliter, then you do have prediabetes. And if your blood sugar is 126 milligrams per deciliter or greater, then you're considered to have diabetes. The next test is a hemoglobin A1C. This test doesn't require an overnight fast because it measures your average blood sugar over the last several months. It's measured on a percent basis, and if you're at 5.6% or below, then you're considered normal. If you're between 5.7 and 6.4%, then you're considered a prediabetic, while if you're 6.5% or greater, then you're considered diabetic. The last possible test that you might have is something called a glucose tolerance test. This is much more commonly performed in women who are pregnant to make sure that they don't have diabetes, but it can be done in all sorts of populations. So after an overnight fast, you'll drink a sugary drink in the morning, and then your doctor will take a blood sugar test about 2 hours after you've ingested the sugary drink. A normal test is when your blood sugar is 140 milligrams per deciliter. Prediabetes is considered between 140 and 199 milligrams per deciliter, and 200 milligrams per deciliter or greater is considered diabetes. So how can I prevent diabetes if I have prediabetes? Well, the first thing you can do is lose weight. Now, while this is easier said than done, your doctor will generally ask you to lose 7% of your body weight. Even if you can't get to your ideal body weight, just losing 10 to 15 pounds can substantially decrease your risk of developing diabetes. If you weigh 200 pounds, the recommended weight loss ends up being between 10 and 15 pounds to decrease your risk. The second thing you can do to prevent diabetes or to treat prediabetes is get active. So the Centers for Disease Control recommends that most Americans get 30 minutes of activity on most days of the week. Now, sometimes this can seem overwhelming to patients. The nice thing about this is that you don't have to go get all 30 minutes at one time. You can either do that, so you could get up before work, or when you get home from work and just go walk for 30 minutes, or you could take 3 10-minute breaks during the day and walk during your break. Both of these achieve the same benefit, and neither one is necessarily better than the other. If you want to prevent diabetes, you're also going to have to eat better. So you want to make sure you get diets that are high in fruits and vegetables, while avoiding things like sweets, refined grains, sodas, and fruit juices. If you smoke, you should quit. This is the single best thing that you can do for your health. One of the important things that many patients fail to realize, however, is that they often need help. And so you want to see a physician or healthcare provider, be evaluated to see if you need medication to help you quit smoking, and get appropriate advice for dealing with triggers and other times when patients are likely to relapse. Medications. So occasionally your doctor may want to put you on a medication in order to prevent diabetes. If your doctor does prescribe medications, you need to make sure that you understand common side effects, need to make sure you understand how to take your medicines, and what sort of conditions or symptoms you would want to call your doctor for. If you have any questions about prediabetes or anything else related to diabetes, you can always shoot me an email, and you can find me at www.diabetesplan.org. I hope you enjoyed today's presentation. If you have any questions, comments, or feedback, feel free to shoot me an email at the website, and I'll be sure to respond. Thanks. Have a great rest of your day.